Henrietta Lacks was born Loretta Pleasant on August 1, 1920. She is remembered as having hazel eyes, a small waist, size 6 shoes, and always wearing red nail polish and a neatly pleated skirt. When Lacks was 4 years old in 1924, her mother died giving birth to her 10th child. Unable to care for the children alone after his wife's death, Lacks's father moved the family to Clover, Virginia, where the children were distributed among relatives. Lacks ended up with her maternal grandfather, Thomas "Tommy" Henry Lacks, in a 2-story log cabin that was once the slave quarters on the plantation that had been owned by Henrietta's white great-grandfather and great-uncle. She shared a room with her 9-year-old first cousin. Their mothers were sisters, and her future husband, David D. Lacks. Like most members of her family living in Clover, Lacks worked as a tobacco farmer starting from an early age. She fed the animals, tended the garden, and toiled in the tobacco fields. In 1935, when Lacks was 14 years old, she gave birth to a son, Lawrence Lacks. In 1939, her daughter Elsie Lacks was born. Both children were fathered by D. Lacks. On April 10, 1941, David D. Lacks and Henrietta Lacks were married in Halifax County, Virginia. Later that year, their cousin, Fred Garrett, convinced the couple to leave the tobacco farm in Virginia and move to Turner Station, near Dundalk, Maryland, in Baltimore County. Living in Maryland, Henrietta and D. Lacks had 3 more children: David Sonny Lacks Jr. in 1947, Deborah Lacks in 1949, and Joseph Lacks in 1950. Henrietta gave birth to her last child at the Johns Hopkins Hospital in Baltimore in November 1950, 4.5 months before she was diagnosed with cervical cancer. On January 29, 1951, Lacks went to Johns Hopkins because she felt a knot in her womb. She had previously told her cousins about the knot, and they assumed correctly that she was pregnant. But after giving birth to Joseph, Lacks had a severe hemorrhage. Her primary care doctor referred her back to Johns Hopkins. There, her doctor, Howard W. Jones, took a biopsy of a mass found on Lacks's cervix for laboratory testing. Soon after, Lacks was told that she had a malignant epidermoid carcinoma of the cervix. Lacks was treated and discharged a few days later with instructions to return for X-ray treatments as a follow-up. During her treatments, 2 samples were taken from Lacks's cervix without her permission or knowledge. The samples taken were sent to Dr. George G's nearby tissue lab. For years, Dr. G, a prominent cancer and virus researcher, had been collecting cells from all patients, regardless of their race or socioeconomic status, who came to the Johns Hopkins Hospital with cervical cancer, but each sample quickly died in Dr. G's lab. What Dr. G would soon discover was that Mrs. Lacks' cells were unlike any of the others he had ever seen. Where other cells would die, Mrs. Lacks' cells doubled every 20 to 24 hours. Today, these incredible cells, nicknamed HeLa cells, from the first 2 letters of her first and last names, are used to study the effects of toxins, drugs, hormones, and viruses on the growth of cancer cells without experimenting on humans. They have been used to test the effects of radiation and poisons, to study the human genome, to learn more about how viruses work, and played a crucial role in the development of the polio and COVID-19 vaccines. Mrs. Lacks ultimately passed away on October 4, 1951, at the age of 31. Her cells continue to impact the world to this day. Rest in peace, Mrs. Lacks. You will not be forgotten.